Hey everyone, it's Jeff. I hope you're doing well. This is the final video, so it's part 2 of my in-person consultation. If you haven't seen part 1, you might want to click up here and go watch that so that things might make more sense so that you can see the entire consultation. Otherwise, here's part 2 of 2. What are the odds that sensation will not be there?
15%.
15%.
Is my best guess.
Okay. Yeah, I know that you can't guarantee anything just to get the...
we really want... We believe sensation is extremely important.
Mm-hmm.
And I take a lot of time dissecting out the nerve on your original phallus so that it can connect to the nerve of your arm.
Okay.
Even despite that, some patients just don't get sensation, and it's hard to explain why, other than the nerve was small or maybe the nerve didn't make the connection it needed to.
Is it possible to connect it later on if there was an issue with the connection?
It'd be extremely tough.
Okay.
The best time to see it is at that initial stage.
Okay.
Yeah.
So I know that you had said that people who are able to move their hands help their, afterwards, help recover faster.
Mm-hmm.
I'm a musician, so hand dexterity is very important to me. I play guitar.
Okay.
And so that was another reason why I was maybe going back and forth between forearm and leg, because I wasn't sure how my hand would be able to form chords and things afterwards.
I see. We had a patient who's not a professional musician who plays guitar. Mm-hmm. He used the guitar as his physical therapy.
Okay.
So he got basically full hand function back by a month because he started playing guitar early.
Oh, okay.
And 2 weeks full stop he was playing.
Wow, okay, that fast.
And he got his function back quick because it forced him to use his hand more and his wrist more. And so he got his hand function back really quickly.
Okay. Another question that I was going to ask was hand therapy at home or here, because I don't know of many hand therapists in Fargo, North Dakota. I haven't really looked into it that much.
Yeah.
But I know that we do have hand therapy here in the initial week. Is that about right?
Yes, and then we also provide the hand therapist that we ask to help us.
Mm-hmm.
They give you a kind of a handout or instructional sheet on what exercises will help.
Okay.
But it's basically use it.
Yep.
Yeah.
Use it or lose it.
Yeah, exactly. Yeah.
And then we talked about fistulas and strictures. What happens if a fistula or a stricture happens at home?
If it's a fistula, we would know before you go home.
Okay.
Okay. And if it is a fistula, we'll give you detailed instructions. Most of the time, they will heal by 3 months.
Okay.
But we do give it about 3 months, a period of 3 months to try to heal.
Okay.
If it doesn't heal, then we need to fix it later.
So come back for another surgery.
Yeah, it could be combined with glands.
Okay.
As could a urethral stricture.
Okay.
If you get a urethral stricture, we get clues. Usually, you have a great stream for a month and a half, 2 months, and then over the past couple weeks, you notice your stream is getting weaker. Mm-hmm. It's taking longer to get all your urine out. You don't feel like you're emptying the bladder all the way, but it doesn't happen all of a sudden. It's usually a slow progression.
Okay.
When it gets to that point, where we start having an idea that it's getting worse, then we want to get you in sooner so you don't have to go to a local ER to get something emergent done by people who
don't know what to do with us, essentially.
Right. But basically, if it gets to a point where you can't pee at all,
mm-hmm.
you can't come here. You got to get it done, taken care of locally mm-hmm. with a temporizing suprapubic tube. They would have to put a tube back into your bladder from the lower abdomen.
Do you... So if it was to that point and I would have to go into an ER,
you would have my cell phone at that point.
Okay, yeah.
And I would instruct you should call me when that happens.
Mm-hmm.
I would instruct you to then have the doctor who's taking care of you call me, and I tell them,
what to do,
this
exactly.
patient has urinary retention, he needs a suprapubic tube.
Okay.
I wouldn't bother with anything else.
Okay.
I would definitely communicate with anyone taking care of you.
Okay, perfect. That leads nicely into my next question. Is there someone who will be checking up on me after in post-op care to make sure that everything is okay? This is aside from post-op appointments?
If there's someone close to you, some physician or professional close to you who you're comfortable with, they can help. Okay. But if there isn't any, then we kind of been doing unofficial either emails or phone call follow-ups. Okay. And it's kind of you reaching out to us. Hey, Dr. Chen, just wondering about this. And I'd say, okay, this is what we need to do. I'll either answer with an email, or if it's more complex, I would call you. Okay. And then we discuss it to see if you need to see someone locally, see me, or is it just something we just need to inform you about.
Okay. And about how fast do you respond, if that?
Emails, I check my email probably 10 times a day.
Okay.
So within 24 hours. Phones I try to reserve for emergencies because I have a lot of patients.
Yep.
I try to tell them, please just use texting and phone calls for emergencies, and anything else go through email. I check my email plenty of times a day that I should be able to get back to you in a timely fashion.
You had mentioned that you have a lot of patients. Do you know approximately how many surgeries of like phalloplasty that you've completed at this point?
Yeah, I've done about 84 forearms.
Okay.
And then 22 thighs.
Okay. And this has been since
October of 2015.
Okay. Yep. I know that Dr. Chen, or no, you're Dr. Chen.
Yeah.
I know that Dr. Crane has been changing his forearm, like how he's taking the graft. Have you seen that?
I haven't seen it.
Okay.
I haven't done it. But what he told me was the plastic surgeons he worked with dissect out an artery from the leg.
Yeah.
So that you don't need as long of a leash here, so you can take a bigger piece of tissue from the arm. If that's something you're interested in,
would that just provide more girth, or what?
Not
does
girth,
that
length.
Okay.
If you don't have to get as long of a leash, you're not restricted to the 50 to 60% on the arm. You could go a little further. You'd have a bigger wound on your arm.
Yeah.
But you would have a longer phallus, but it doesn't add girth.
Okay. Let's see here. That takes that question. And I know that you had said that maybe 5 inches would be probably the best.
The one thing I should mention, that since length is a question that's recurring, your skin is elastic.
Yeah.
When I pluck it, it kind of goes back, right? That elastic property, when you take it from all of its attachments, are going to make your phallus shrink a little bit. So it may end up being like 4 or 4.5 once you cut it free. Even though your wound defect is like 5.5, your phallus may end up being 4.5.
Okay.
Because the skin snaps.
Yep.
Over time, gravity kind of works on that property and stretches it back out.
But not to a huge degree.
It may return back to the 5.5 that it was in the beginning. But I doubt it would go longer than whatever the defect was on your arm.
And that's fine. I'm not looking for like a 6-inch, so the longer doesn't necessarily, for me personally, it's not that big of a thing. Do you think that I need to do electrolysis down here?
Yeah.
That's what I was...
Yeah, it's optional for you.
Okay.
Yeah.
Would electrolysis on the leg be needed for the graft coming over?
No, because we take a split thickness skin graft, which means we don't take the hair follicles.
Oh, okay.
We take the hair because we cut the hair, we shave the hair, and then we take the skin graft and put it on, but there's no like hair follicles.
Okay.
So you don't need to do electrolysis.
Perfect. That's why I came here, really, to be honest. Other than meeting you in person, but also because I've never had a lot of hair. People have asked me, like, do you shave your arms? And I'm like, nope, this is what I've got.
I'm kind of the same, like, I'm optional also.
Yeah.
Yeah.
Let's see. I think that was most of my questions. I think that might be it. Is there anything else that you think that I should know at this point?
Well, the waiting list is about a year.
Okay.
Right now, and if you're interested, we can start the process. If you want to talk to other people, talk to Dr. Crane or other surgeons, I think that's a good time to explore too. The benefit of, I guess, this environment right now is there are more and more surgeons doing this, so you have more choice.
Yeah.
I don't want you to feel like I'm the only one. You know,
right.
There's a number of us out there now.
Okay.
But I feel like I'm doing well. So it's kind of, but it's good to have
options.
Yeah.
Okay. Let's see. So at this point, it's about it's January right now. Yeah.
So about a year.
Probably January next year as well. Okay.
To confirm, it would be a left forearm phalloplasty.
Yep.
Vaginectomy, scrotoplasty, urethral lengthening.
And potential glanoplasty.
Glanoplasty.
Probably not.
Oh, we won't know until we get there.
Right. Looking at my arm, can you make a guesstimate? I know that you can't guarantee anything about what girth it potentially could be. Are you able to make that?
I can make a guess.
Yep.
Anywhere from like 3.5 to 5.
Okay.
But not 5.5.
Okay.
And again, the girth depends on the underlying fat.
Yep.
The more fat you have, the girthier the phallus.
Okay. And yeah, I've always had fairly small arms. I was also worried that maybe I was too skinny of an arm, or has that happened?
It has happened. There was one patient whose arms were really thin, and decided to go with a thigh as a result, even though he knew the thigh had higher complications.
Mm-hmm. And so he went in without having any electrolysis for the leg.
No, he did.
He did. Okay.
At his initial consultation, we looked at the arm, checked out the thigh, and after finding out that he wants to stand a P, he wants a bigger phallus, he doesn't want a skinny phallus, wants a slightly longer length.
Then ALT
the thigh is the only way to go.
Yeah.
Okay. It definitely depends on surgical goals.
Mm-hmm.
You know, we've had other patients say, "I want a 3-inch phallus." We're like, 3 inches? It's like, your arm could give us 5. It's like, no, I just want 3.
Yeah.
So everyone has their own
idea
surgical
of what
goals.
they want.
Exactly. Yeah. So we try to pick the body part that fits it as long as it's safe.
Mm-hmm.
And you're thin. Do you want me to check out your thigh to see if it's possible?
Yeah.
Okay. So the easiest thing, we'll just stand in this corner here.
Okay.
If you can drop your pants down to here, and I'll just check out your thigh. Okay. Yeah, so you have that deceptively super thin, but you deposit fat just like me and everyone else in your thigh.
In the thigh. Yep.
Yeah. So your thigh would have a girth look like that.
Yeah. A soda can.
Yeah. So not an option.
Right.
Okay.
Yeah, I figured that would be true. Like, even if
this is why it's better to have in face, especially if you're considering thigh.
Yeah.
So I can examine you.
Yeah.
Because you look super thin and healthy, and you are super thin and healthy, but you have the natural predisposition, like everyone else, to put more fat in their thigh.
Mm-hmm.
Like my thigh would be awful. It would be like, yeah.
And no one would want to be anywhere near that. I think that might be it. I don't know if I am missing anything, or if there are things that other people ask, or
if other questions arise. I mean, we have a lot of time.
Yeah.
If other questions arise, feel free to make a phone follow-up, you know?
Okay.
And I'm happy to just call you. Now that I've seen you, you don't have to come all the way out here again.
Okay.
We can just talk on the phone. Like, oh, if you have more questions, let's talk.
Okay. And then you would typically do that on a Thursday. That's your consultation day?
Typically.
Yeah.
Yeah, typically.
What are your typical surgery days? Do you have a specific set
right
day?
Right now, it's like Monday, Wednesday, Friday on average. Sometimes there are Tuesdays, but usually Monday, Wednesday, Friday.
And it's just going to be one surgery a day?
Yeah.
Because, you can't.
Yeah. It's... we're making good time without rushing, so we're done around 3. Mm-hmm. But adding another one after that,
that would be
we'd be done at like 10 or 11.
Yeah.
That's too much.
And then to be expected to do that
again,
times.
Yeah.
The microsurgeon team, have you been with that surgery team for a while now?
Since August.
The
new team we hired, Dr. Crane hired in August.
Okay.
I've been working with them since August.
And that has been fairly good?
They're good. Yeah. They're good. Like, technically, they're good plastic surgeons.
Okay.
You know? The only thing different between them and the prior team is that they don't have the phalloplasty experience.
Okay.
They have the plastic surgery experience and the skills to do a phalloplasty. Mm-hmm. They just don't have the phalloplasty experience that those guys had.
Mm-hmm. But now, at this point, it's been a few months, and...
Yeah, we have probably close to 40 now that we've done together. Yeah. From August till now. Okay. We've done about 40 together. And I've seen them operate. They're technically good surgeons, you know? Yeah. Like, technically what I mean is, like, technique and... Right. You know... Logistically and everything. They're good. Mm-hmm. They just don't have the 200-plus phalloplasty experience that the other guys had. Yeah. Okay.
And I think that... Yeah, I'm just trying to remember if there's anything else, but that was the list of questions that I had, and I think I'm good then.
Okay, then the next step is I'll contact the staff, and they'll reach out to you in a couple weeks. Okay. They will try to work out something, like a date, and make sure everything's okay.
Okay.
All right?
Perfect.
Thanks for coming all this way.
Thank you so much. Thank you for taking the time to see me. And
oh, you're very welcome, Jeffrey. Thanks for waiting for me.
Yeah, no
Appreciate
problem.
it. All right?
Thank you.
All right, buddy. When you're ready, the door's like right there.
Okay, perfect. Thank you again.
You're welcome.
And that is it. That was my entire in-person consultation with Dr. Chen. It really only took 30 minutes, and that's all the questions that I had for him. That's the information that he gave me, but if you have any questions, feel free to leave them down in the comment section down below. And as always, please remember that you are valid, you are loved. I hope you all have a wonderful weekend, and I will see you again with another video on Monday. Bye.